Yes, thank you very much for that. I'm not quite sure if you can hear me very well. I'm going to talk about the COVID-19 response, regulatory response in Yemen. But I'm not sure if you can hear me. Can you? Okay, so I'll start. Of course, after apologizing for this technology problem, we have an internet issues here in Yemen. We in any crisis, we used to divide the life cycle of the crisis into 5 stages. The first stage usually starts with the preparation or the contingency phase, contingency planning for any potential crisis. Whether it's natural or human-made one. So talking about the current situation in Yemen and the COVID-19, it comes with an already complex situation where we have a protracted crisis since 2015 because of the war. So this is the main challenge that's faced by the country in Yemen. And as you see on the screen, this is the map of the country of around 500,333 districts and the population of around 31 million. And if you please move to the next slide. So within this life cycle, I said that we start usually with the preparatory phase, where we do commit to the communications, we commit to the contingency planning, we commit to the evaluation of assets, also to the training and capacity building. Then we come to the second phase of any crisis, which is the response and control. And this is the main topic of my presentation, where the response and control needs to adapt the plan that we already prepared for during the contingency phase. And then we come to the third phase, which is the crisis itself, and the recovery and the evaluation. During the crisis phase, of course, we do some sort of trust building with the communities and make sure that we are coping with the environment, coping with the situation, and fostering resilience. During the recovery and evaluation, we have the lessons learned and whatsoever. So these are the figures from Yemen related to the registered numbers of cases and also of deaths. And this is the main challenge that we are facing is related to the accuracy of figures, but also the war itself and the division, the political division in the country that presents by itself a huge challenge related to a unified mass casualty management, unified data collection from all over the country. Next slide, please. Now, when we talk about the management of the pandemic, we start with the investigation, of course, and implementation of control measures and then monitoring. For investigation control, and how we do the what we call the outbreak investigation. In this case, it's more than outbreak, it's an epidemic in Yemen, pandemic all over the world. We need to do some sort of implementation control measures. And this is related to cases, treating them, and also preventing others from being sick. And as you know, in COVID-19, we have 80% of the people, of the infected people, they do not need to go for any hospitalization or any complicated treatment. So 20% of the population needs some sort of medical treatment, medical management, 5% of which needs hospitalization and needs critical care support. And then we have the monitoring of the control measures that we are applying in the country. And this is how we need to understand the control measures and understand the response that we have within the regulatory system in the country and how the regulations are fit to respond to the crisis. Next, please. When we talk about the situation in Yemen, we have the national level investigation functions. And here we need to identify, of course, sources and causes of the problem. And as you know now, the source of the infection, well, this is the index case, usually what we call, it's not the issue now. The issue now is about the super spreading cases that comes into the country, and then from there it multiply because of the multiplication of cases, what we call replication, or the R note. The R note is the replication number, how many people are infected because of one single person who is already infected or she is already infected. So what we need to do some sort of reduction, elimination, and control of the infectious disease, and this needs to be in line with ensuring the acceptability of the population, acceptability of them, of the measures that we are taking. So for the R note, for instance, how we can minimize the number of people who are infected because of the single case that's replicated in the community. One can infect, at least with the COVID-19, between 2.7 and 4.5. Let's say 4 people. If one can infect 4 people, each one of the 4 will infect another 4, and then you see the logarithm, and you will see how the multiplication occurs and the disease spreads in the country. So to ensure the acceptability of the population is something very important to apply the control measures that we need in the country. Next, please. So part of the regulatory and control measures, of course, it needs to work with the healthcare professionals, and to control, and also to work with the population in general. So the healthcare professionals needs to be aware of the spread of the causes of the risk related to contracting the diseases, and the essential control steps. And unfortunately, we have so many healthcare workers, physicians and paramedics who lost their lives recently in Yemen because of COVID-19. Next, please. So we have what we call the determinants for the intervention. The determinants are related usually to the severity of the problem, the level of certainty about the outbreak, and also the source and mode of spread. Related to the severity of problem, we have things that are beyond the direct health and medical situation. Yes, we have to know exactly the nature of the complications, which is related to morbidity and mortality, duration of the illness. We know that now the incubation period is set between 2 and 14 days. The mean about 5 days. But we need also to understand how we are going to respond to the needs of the 5% that I mentioned in the beginning. 5% of the people who need hospitalization. And beyond the health sector, we need to learn about the economic impact. The lockdown in a country like Yemen might have an implication that will go beyond the direct health effect and the direct health issue and the direct health complications. So we have other economic complications that we need to avoid when we're talking about COVID-19. Then let's go to the next slide, please. The priorities of the investigative and control measures are related to the causality and the causative agents. And we need to know exactly what's the source and mode of transmission, and not take much time on that. So please, colleagues, if you can go to the next slide. The types of response, we have the immediate and delayed, multiple, single, and depending from the mode of transmission. This is not in COVID-19 per se, it's in any outbreak or any epidemic. So the immediate response that's need to be in line with what we said when I mentioned when I mentioned the life cycle of any crisis. It's related to the preparatory phase. The immediate response after the preparatory phase, which is the response and control phase, is depending on how prepared we are. If we have the trained personnel that are prepared for any scenario, and then they can respond quickly. Next, please. So we have the usual sequence of events. You can see here in the chart, from the primary case till the latest stage. We can lose so many people either morbidity or mortality rates are high because of the lack of measures, regulatory response measures, which needs to be set, as I like to repeat again, in the first stage, which is the preparatory phase. Between the primary case and the response, we might lose so many people. Are we prepared for that, for the regulations? Are we prepared for the lockdown, for instance? Are we prepared for the lab investigation? Are we prepared for the PPE, which is the personal protection equipment, for all the measures that need to be there to mitigate the risk and also to control the situation before what we call the flattening the curve occur? The curve cannot be flattened unless we have all the preparatory measures and the mitigation risk measures in place. Next, please. Here we can see the ideal sequence of events. The ideal sequence of events where we have good control measures from the beginning, good preparatory assets and capacity building in place before we reach to the second stage, which is the response and control. Then the response and control will be able to do what we call the potential case prevention. So we are preventing more cases from being infected in the communities. And this is also related to the economic impact, where more people are able to go back to their work because of the early control measures that's taken into consideration. Next, please. So the type of intervention, the types of interventions related to the regulations that needs also to be supporting the medical and health interventions are usually related to sanitation, prophylaxis, diagnosis, control of the vector. So sanitation is related to environment, and this is beyond the health sector to other sectors that are involved in environmental health. And we have the prophylaxis, where we have the barriers, where we have the protection measures in place so we can control the infection. And then the diagnosis, of course, through the lab investigation and the availability of treatment. And in this case, there is no treatment. And even the protocol. Now in Yemen, again, for the regulatory response issues, we have a protocol for management of cases that needs to be also always to be revised by physicians and experts, also experts to make sure that we are diagnosing according to the guidelines. And then we have the control of the vector, and the control of vector is still difficult to do, considering the situation of the country, unless we have a total lockdown, and this is not popular, of course, and acceptable by people. Then we come to the next slide, please, which is the triad of the epidemiological triad, where we have the host, agent, environment. And also, if we can skip this one and go to the next slide, the chain of infection. So for the chain of infection, we have, next, please, again. This is the triad, the host, agent, environment. So we have, for the chain of infection, we have the reservoir, in this case, the people, the person, the human. And then we have the susceptible host. Between them, we have the route of transmission. And we know what's the agent here, which is the virus, that the SARS-CoV-2, which is the responsible agent for the contamination and for the spread of the infection. Next, please. So the strategy for controlling the diseases, identifying and reducing or eliminating the infectious agent. Now, the source of the reservoir, the source here is the people themselves. So how we can eliminate that? Of course, by the lockdown and by taking the infection control measures, starting by the distancing, the physical distance between one person and the other. And in COVID-19 is set for 2 meters. 1.9 or around 6 feet. And then we have the breaking of interfering with the routes of transmission of infectious agents. The routes of transmission, as we know, is through the respiration, through the respiratory droplets, and this needs also to be maintained through the physical distancing and through the other PPE, like a mask, the mask, and how we control the infection. Last will be the susceptible host. identifying them who are the most susceptible. And in this case, of course, we talk about elderlies and people with chronic illnesses, especially heart diseases, high blood pressure, and diabetes. Next, please. This is a repetition to what we said about the control of the reservoir. We have the human, the environment, and we have the animal. In this case, we are talking about the COVID-19. There's no animal issue here now. It's started from the animals. We are still waiting for studies on that. But now the mode of transmission is related to person-to-person transmission. Next, please. The control strategies for the agent, of course, is related to treatment and disinfection. For treatment, usually we use the antiviral, but antiviral, that's the line treatment is not there, but we use antibiotics only for cases with secondary infection or bacterial infection. And again, it depends on the case. Next, please. So control strategies for direct transmission. To do that, we have to think about the isolation as a strand of precautions. Of course, the isolation is the main way of controlling the transmission. This is what we are all aiming at. We are trying to minimize the risk through the isolation and quarantine, and also the barriers that we are using. In this case, we have the masks, and then eliminate the high-risk behaviors. Next, please. Control strategies for direct transmission. As we said, the isolation, and for the isolation, we need to restrict movement or separate people from each other, or at least where we have people at risk, they need to be isolated, so we minimize the risk of being infected and then the complications that are expected because of their case, especially the elderly and people with chronic illnesses. Next, please. The control strategies for direct transmission is related to hygiene, the hand hygiene, using gloves, masks, eye protection, and also transmission-based precautions specific for route of transmission, in this case specific to the respiratory droplets and the routes of transmission that we are facing. With the control strategy of the host, of course, we have the behavior change, we have the barriers, we have the immunization, prophylaxis, and improve host. I just highlighted the immunization part because we're still waiting for a vaccine to be introduced. Hopefully, this will happen during the coming few months. Unless we have an immunization activities all over the country, we will not expect to eliminate the virus because of the situation that we are facing, because of the difficulty of locking down the country. And when we are talking about herd immunity and to get the R0 to the 0 or minus levels, this needs to be related to the herd immunity, and this will be difficult to obtain without the vaccination. Next, please. We have the disease-specific control measures. We have the report to local health authority, isolation, disinfection. Again, immunization is highlighted because of the situation, and in quarantine and investigation of contacts and source of infection, and specific treatment according to the case. Next, please. The interpretation of lab tests. Again, laboratory is very important issue here in relation to the magnitude of the problem, how many cases we have, and to know exactly where we are. Testing more people would give us the indication for the epidemic curve. Epidemic curve means that are we going upwards or downwards? Are we in the stage of decline where we have less cases, and then we can say, yes, this wave of the pandemic is ending or not? Next, please. For this, of course, we talk about the test accuracy, and I will not take much time on this. It's very diagnostic specific. Next, please. The terms. The test validity is very important to be cautious about that, and to make sure that we can differentiate between the truly positive cases and falsely positive ones. So the next, please, we have what we call the PVP, which is the positive predictive value. And this is related to the positive tests between the ill and not ill. And through this, we can determine the accuracy and the validity of the test. That's why we need to sometimes repeat the test more than one time. Next, please. Proportion of people, of course, who are positive. Again, next, please. Test positive in the disease, and also the proportion of people who are falsely tested positive. This is very important for understanding the situation. Lastly, I would like to come to the recommendations. So if you can skip the slide. Yes, the recommendations we have. Mainly enhancing the sectoral coordination. As I mentioned, we were talking about this epidemiologic triad where we have the host, agent, and environment. With the environment, we have more than one player. We have the multi-sectoral issues, which is very important to address. We have promoting the healthy behaviors to reduce the spread. We don't have lockdown. At least we need to apply the physical distancing, and we apply the PPE, very important issue. The next slide, please. This is the recommendations. Maintaining a healthy environment, which is very important for the sanitation purposes and for the healthy populations, healthy communities. And then maintaining healthy operations and regulatory awareness. And this will not be done through the crisis. Usually, this needs to be prepared for during the first phase of the life cycle of the emergency. And then we have the management of sick people and the documentation and lessons learned. Thank you very much.